Hi, my name is Amanda LeMarier, and I'm a physical therapist here at Duke Health. I see a variety of diagnoses and dysfunction, so anything from neck pain to back pain, shoulder pain, knees, elbows, ankle and foot, also any post-operative rehab, total joints, total hip, total knee. I specialize using manual therapy-based techniques within neck pain or any cervical radiculopathies. The thing that I enjoy most about my job is getting people back to function, reducing their pain, getting them back to their goals. You know, it's a long process and sometimes it can be a little rocky at first, but once we hit through the major milestones and decrease your pain, and once you can kind of see that light peeking through, I mean, you know, a lot of people say, I didn't expect to feel this better. Well, it can happen. That's what we're here for. We're here to get you better and achieve your goals. Here at Duke Health, especially within physical therapy department and specialization, we make it patient-centered and patient-oriented, and we make it fun. You know, whenever you're in the clinic, people are smiling, people are jovial. There's never tears or anything like that, so we try to make it about the patient. Since 2010, I've been a Boston Marathon volunteer in the medical tent at the finish line, so I'm used to treating runners and any dysfunctions or impairments, muscular cramping or severe things, so I also enjoy working with the running population.